Welcome and thank you for taking the time to view my Simvention. My name is Jason Burgess and I am a registered nurse in the field of neonatology and an NRP instructor. Stepsinsitu is totally self-funded endeavor and I have nothing to disclose. As an NRP instructor, I often found it difficult to give the real-time responses to a team during a megacode in a manner which addresses each action. Not only that, but tracking all the actions and responses left me forgetting teaching points. I wanted to create something that can handle not just scripted responses, but any responses. I wanted to create real scenarios that I had personally experienced and built out every possible combination of actions. Add in the power of computing to alter the responses to the team's skill level, and you get a program which will provide a different experience every time you run it. What we're about to look at is an early build of Stepsinsitu. We hope to have this ready for you all by the time you're viewing this presentation during IMSH 2021. This scenario I'm about to show you involves a situation that I was a part of. We were emergently called during a Code Crimson to assist the resuscitation of a term infant. When I arrived, it was a chaotic scene. There was blood on the floor, a medical team working on the mother, and a nurse standing over a pale tachypnic infant trying to stimulate the infant to breathe while holding a mask over the infant's face. What you'll need for this program is an internet connection and a tablet. This program also supports dual tablets, and now you can get as realistic as you want to during the scenario, using your own mannequin or equipment, but unfortunately we do not sync up with any other high fidelity simulators at this time. So what we're going to do here is we're going to sync up our simulators. So on the secondary port, we're going to log in as a participant monitor, and that's going to go into a pairing mode. On my facilitator's tablet, I'm going to go and pair up with the second one that matches up, and this will take me into my dashboard screen. At this point I'm going to actually select the scenario that I'm going to use for this 38-week staff assist call for maternal bleeding, and I'm going to select my skill level, my team skill level. So for this I'll choose beginner, but as you can see, beginner, intermediate, and advanced all have different requirements. So positive pressure ventilation will return positive chest movement majority of the time, or half of the time, or most of the time. Intubations will be successful. For this I'm going to choose beginner team skill level. This one only requires 2 objectives to complete, so you can choose any 2 objectives that you want. For this I'll choose establish a stable airway, and we will administer epinephrine. So you can also choose 3 or 4 objectives, but this requires 2 objectives. You can, if you want, you can add more rounds of chest compressions to complete. So it's going to wait till it achieves those type of goals before it will check you off so you can continue on. So we're also going to select which oxygen delivery method we are using, since every different organization uses different oxygen delivery methods. Here you're going to be able to add your team members. So for the public release, it will only add your team members, like your nursing or your respiratory therapist, paramedic. You can add those just so it can help balance out your team, or it can show you what you're working with. Future releases, actually, the organizational release of this, you can create individual accounts and track and trend your performance, beginner level, intermediate, and advanced. So here's the pre-briefing of the team. On the main tablet here, you can see, as I explained, this was a staff assist call for maternal bleeding. This is what you would explain to the team so they're ready, and you're going to proceed. So this is the setup. This allows the team to set up their bedside, turn on their oxygen. So I'm going to go over to the tablet for the facilitator, or for the participants, and I'm going to turn on their oxygen for 11 liters. And for this one, actually, since when they arrived, the nurse at the bedside has already turned on 40% oxygen. And the assistance light was called because we're arriving to address that. So the team's all ready. Everyone's ready to run this scenario. The facilitator will start the timer. Now, when I start the timer, it's actually also mirrored to the participant's tablet to be in sync. They will read their overall assessment. This is on their tablet is what they will get their information. So let's say they listen with a stethoscope. They will get a chest assessment when I tap the stethoscope button on the main tablet. The heart rate, notice how it was only there for a few seconds and then it disappeared. If I tap it again, the heart rate will be decreasing based on the team's skill level. They're also going to put on a monitor. So notice you have a EKG rhythm and the saturation does not pick up because typically a new infant would not have appropriate perfusion. So we're trying to keep this as realistic as possible with little details that will help with immersion. So this situation, the lungs are clear on the right, faint on the left. Heart sounds are difficult to oscillate. I'm going to start positive pressure ventilation. Actually, the team is going to start positive pressure ventilation, which will give them a response that it looks like there's infant is still tachypnic with shallow respirations. There are some intercostal and subcostal retractions that are present, and they're going to listen again. Lung sounds are faint bilaterally. That heart rate is still low, so they need to do something about it, which they are going to turn up the oxygen to get that saturation up. That does respond. It brings up the heart rate slightly, and the saturations will increase slightly. At this point, the team decides to intubate. This takes you to a emergency procedure screen as a facilitator. This allows you to track the team's response to make sure that they are following the American Academy of Pediatric guidelines of steps for the skill. You can follow it along. And when you proceed, the computer will decide whether the patient is or the team is successful at their intubation or unsuccessful. For this situation, the intubation shows color change on the CO2 detector. They are actually successful. Heart rate is kind of low still, and the lung sounds are clear on the right, faint on the left. At this point, the team decides to reposition the endotracheal tube because they think that it's maybe right main stem. And the infant shows mildly improved activity. The infant is still pale with shallow breathing. So as you can see here, you can do anything that you want to follow along with. They can do chest compressions. For whatever reason, they decided to start chest compressions. Notice how the EKG rhythm and SpO2 rhythm has become dampened, or there's a lot of noise. And that's because realistically, when you're trying to do a chest compressions, you're not picking up a good rhythm strip. So one more little thing that tries to bring in realism. So at this point, they can stop the chest compressions, or they can just click on stethoscope button, which will stop it automatically. Now this baby is in a really dire situation. The baby will need epinephrine. So you have now, because you only have an endotracheal tube, you have the option to give epinephrine through the endotracheal tube only. This asks you if the correct dose between 1.5 milliliters and 3.0 milliliters was given. This team decided no, they were giving a different dose. And as you can see, the infant is still pale, dusky, and limp. And the lung sounds are clear on the right, absent on the left at this point. So we're in a bad situation here. The team is actually going down the wrong pathway, and the instructor is like, let's stop for a second. So we're going to pause it. And at this point, we're going to talk about what was going on and what the team was doing. And they want to get them back on the right path. So at this point, they're going to undo a couple of actions to when they intubated. They're going to bypass starting chest compressions when the heart rate was above 60. And they talked about it. So now they're going to resume. And at this point, the heart rate is 76, and they're going to go up to 100% oxygen. Given the fact that this baby is hypovolemic because mom was abruption, they're going to place an umbilical line. You follow along with their actions. umbilical line is placed, and at this point they're going to administer saline bolus, and they do have the correct dose. So saline bolus is started, and this starts an internal timer, so it will give you a response of how long they gave the saline bolus over. And the importance of this for a neonatal population is rapidly infusing saline to a neonate increases the risk of intracranial hemorrhage. So I was seeing it time and time again during simulation. People would put in an umbilical line and they'd say, "Oh, saline bolus is in." And I would look at the team and say, "It was only 30 seconds. How did you push that saline bolus in so fast?" I want everybody to simulate like they practice and practice like they simulate. If they're not going to administer that saline bolus over 30 seconds in a real life situation, I don't want to see them doing that in a real life or in a simulated situation. So back to the simulation. You are able, let's say I stop the saline bolus and the heart rate is now improved, saturations are improved. We're a little bit better here. Now we're going to listen. Lung sounds are clear on the right, faint on the left. I'm going to stop the scenario here, but over time what will happen is once you hit your objectives, you will stabilize the patient and you can go to a debriefing screen. So I'm going to take you to the debriefing screen now. And we are going to see everything that happened. So this program recorded every action, every change in setup, the oxygen overall assessment, what the heart rate was, what the saturations were, and the flow and the FiO2, what the situation, if they listened to the lung sounds or not, and the outcomes. You're going to see here where they went down the wrong pathway and they started chest compressions, and see how they're strike through. Those are because we backed up our steps. And if you can see everything here, including your report for your intubation, I'll take you on that. You can see every action that was completed. And if the team kind of misses steps, now is a great time to go over those skills. So at the end of the scenario, you can save and return to dashboard. What this will do for organizational accounts is that will send off a copy of the debriefing to every person that was participating in the scenario, and they can have a copy of the debriefing along with what level they were doing the scenario at, what objectives, and they can track and trend their progress. So that is pretty much a demo of what I've been working on. I want to thank SSH and IMSH2021 for the opportunity to demo this Simvention, and I want to thank all of you for checking out my demo. You can try it for yourself. We'll have our initial release to the public by the time you're viewing this video. You can download it today, try it out on your Apple or Android tablet, and enjoy the rest of the conference. Look forward to hearing more from all of you and getting your feedback on this Simvention. Thank you and have a wonderful time.